Dr. Zainab Almossalli, Arab Board Certified Dermatologist. She graduated from Arabian Gulf University in 2011 and did her internship in Salmania Medical Complex. Since 2013, she joined Dermatology Department in Salmania Medical Complex as trainee and finished her board in 2017 from first attempt. Currently, Dr. Zainab is Chief Dermatology Resident at Salmania Medical Complex, member of the Training Council for Step Dermatology Residents at Salmania Medical Complex, and a dermatology tutor at Arabian Gulf University. She presented in many regional conferences. With that, I ask that you give your full attention to Dr. Zainab Al-Masali.
Okay, so today I will speak about Arab board in dermatology and venereology in specific, but I will try to give you some glance about the Arab board in general first, and also Dr. Abdullah, my colleague, gave you some information also. So Arab board requirements, to be an Arab board certified doctor, you have to have an MD degree from an approved university by the Arab Board Council. You have to be registered in your country or the country that you will be trained in. Like here in Bahrain, we have Bahrain license exam and you get your license from Nahra. You have to be finished your internship year and registered in a recognized training center by the Arab Board Council, which is in Bahrain, mainly Salmania. The start date it is in October each year. Usually the selection starts from March until September. The duration depends on the specialty, which is from 4 to 5 years. Usually all of the specialties is 4 years, except for surgical specialties like ENT and surgery, they require 5 years. So regarding my personal experience, I have graduated from the Arabian Gulf University in 2011. I was with Dr. Abdullah. From 2011 until 2012, I did my internship training in Salmania Medical Complex, where I did an elective in dermatology department. If you are pursuing an residency, it's advisable to do an elective in the desired specialty. Since 2013, I joined the dermatology department in Salmania Medical Complex. So as an R1 resident in dermatology or in Arab especially, the first year is designed to give the dermatologist a broad clinical experience on other fields, which is very important as a dermatologist. You can see from the bulk is in internal medicine, where we can share our experience in rheumatology and ID especially, but in other even endocrine, respiratory, and GI. As you know, or as you all know, there is a cutaneous manifestation of systemic disease. Moving on with a 12-week rotation in pediatrics for the same reason. 6 weeks plastic surgery rotation is mandatory to get used to suturing and performing like simple procedures. Finishing by an elective. Usually we do our elective in the pathology department because dermatopathology, which is a very important aspect in the board, and 4-week vacation. By this, you can finish your first year, which, as you can all see, it is away from the dermatology department. Moving on to R2, for you to go further in your residency, you have to enter an exam, which is held by the hospital itself to transfer you to an R2 resident. Once this is done, you are eligible to enter Part 1 Arab Board exam, which is almost in all of the other specialties, it's the same. It's mainly MCQ based, which is written, around 120 questions, mainly targeting the basic part of the specialty that you are in. Like in dermatology, we study mainly basic anatomy, immunology, and everything in dermatology. And at this time, you also to start your main focus and training in dermatology department between the clinics, outpatient clinics, inpatient wards, and ER patients. And by the beginning of R2, you should have finished your Part 1 examination. Moving on to R3 residents. Again, you have to do the exam, which is conducted by the local training committee. And in this year, you have to prepare the research, which is a requirement for the Arab board to enter the final examination. Usually, the research should tackle the specialty that you are in, especially in dermatology. And you will continue your training in the outpatient clinic, inpatient wards, and the ER patients. Moving on to the last year, for us dermatology, we have only 4 years in residency. By entering year 4 after the local exam, as it has been done in the past 2 years, you have to, by R4 residents, you get more clinics and more duties in the department, especially in the ER and in the outpatient clinic. By the end of R4 year, you are eligible to enter Part 2 examination. If you joined the Arab board a little bit late by like 1 month or 2 months, which happened to other colleagues, you will not be able to enter the exam, the Part 2 exam on time. So the Part 2 exam consists of 2 parts. The first part, which was a written exam, that consists of 240 MCQ questions. After passing this exam by 1 month or even 2 months, you are eligible to enter the oral or OSCE exam to get the certification, provided that you submitted your thesis and research. Okay. So how to be a consultant after finishing the Arab board? As Dr. Abdullah mentioned earlier, that in Bahrain now, you cannot be a consultant by Arab board itself. You have to do a fellowship for a duration, advanced fellowship for 1 to 2 years, which is in dermatology. You have to choose one of the subspecialties there, which is dermatopathology, which is mainly to deal with the skin biopsies and shape biopsies, surgical dermatology, where they have such a, but it's highly competitive actually to get acceptance in surgical dermatology, advanced medical dermatology, immunodermatology. It's an upcoming subspecialty, but you cannot find so many centers providing such a fellowship. Pediatric dermatology, photomedicine and laser, very highly competitive, mainly found in Canada and the US, and you need to be very, you need to be willing to do research-based fellowship before getting the post. And aesthetic dermatology, which is also very difficult to get. After finishing 1 to 2 year in advanced fellowship, according to the Nahra in Bahrain regulation, you can become a consultant. Otherwise, with the board itself, you are only a specialist. So tips. A typical week as a dermatologist in Salmania Medical Complex, we have, where I work, we have 5 days per week clinic. So mostly our work will be in the clinics. 4 days general clinic, and 1 day procedure clinic, where we do some simple procedures like punch biopsies, shape biopsy, electrocautery, cryotherapy, and intralesional injections. We have some residents to assigned only for morning on-calls to see ER patients and inpatient consults, which is hectic. And we have evening calls to see ER patients, morning rounds if we have an inpatient, which is not that much common. Okay. How about on-call? As a dermatologist in a busy hospital like Salmania, you will have a hectic on-calls. So keep this in your mind if you are planning to join us. We have a morning call and we have evening calls. The morning call mainly consists of a senior or a chief that's usually finished his board and waiting for his fellowship, and a junior, which is in a training STRP resident. We see inpatient consults and ER patients depending on the demand. And the evening on call, it depends on the number of residents. It's almost every 4th or every 5th day, and we see mainly ER patients. No inpatient consults, unless it is something emergency, like to rule out a drug eruption also. So in dermatology, we like to volunteer, maybe because we have some time to do that. So we usually participate in Bahrain Sports Day to educate the staff about different dermatological aspects. We have a yearly celebration of World Psoriasis Day. Unfortunately, last year, due to COVID, we couldn't do that. And we participate in TV shows, especially in Bahrain TV, to present different dermatological diseases and how to deal with them for the population. And finally, we had the chance to participate with Sahabat Amal, which is a well-recognized community in AGU in one of الفعاليات كان اسمها خلها تلق مع دكتورة مريم الله يذكرها بالخير. Hopefully we can do this in the future soon inshallah after COVID. So tips. I get a lot of questions. How can we get into dermatology? Especially it's a very highly competitive and difficult department to get into. First, piece of advice, try your best to do an elective in dermatology in the desired hospital that you want to work in. Because if the doctors there knew you, it will make your life easier because if you showed your interest, how hardworking you are, how excellent as a doctor you are, they will remember you in the interviews. Try to, after getting the elective, try to get a case report with one of the doctors there and try to publish it, which is not that much difficult in dermatology due to the high volume of journals we have. Try to attend some dermatology conferences in the region like Dubai Derma and PDLA. Dubai Derma, they have a special course which is called pre-conference called. It's especially designed for people in the Arab board of dermatology. So when you attend it, you can see the other doctors trained in the board and even the mentors in the board itself, they present in that conference. And PDLA is one of the conferences that is held in Bahrain. So it's quite easy to attend. So to conclude my presentation, why to be a board certified dermatologist? A board certified dermatologist will deal with the skin, hair, nail, and mucous membrane. So as you can see, you can focus on treating diseases. Becoming a dermatologist requires many years of education, not as any other people think. You need to finish your medical school and internship and enter the dermatology residency for up to 4 years, and then to do your fellowship. So thank you, and remember, there are no shortcuts to any place worth going. Work hard, try your best to get a recognized residency in the specialty that you want, and go through the proper line, no shortcuts. And if you have any questions, I'm open to answer any of these.
Thank you so much, Dr. Zainab, for your very awesome presentation.
Thank you very much.
If anyone has any questions, please, you can write in the chat.
So I guess I don't see any specific questions. And thank you, everybody who attended, and thank me, especially Mariam Waqi, my role model and my training coordinator when I was a resident. It's such an honor that you attended my presentation. Thank you very much. Thank you all, Falah, Hawra, Bayan, Wala. And thank you, Hassan and Aisha, for this great organization of this conference.
You're welcome, Doctor.
And Dr. Haifa also.
And thank you for participating with us.
Thank you.